And so I want to take a moment to introduce our new Senior Director of Research, Tiho Enev. Tiho, maybe you can say just a few words about yourself.
Hello, everybody. My name is Tiho Enev, and I joined ASTHO at the beginning of this week. And I hope that I'll be helpful to you to complete this survey. And currently, I'm supporting the ASTHO staff to to design and administer the survey.
Great, thank you. We also have with us Alana Kittle, who's our Senior Analyst of Survey Research. Alana, do you want to introduce yourself?
Thanks, Rivka. So I'm Alana Kittle. I'm going to be helping Rivka to administer and run all the data on the survey. Look forward to working with all of you.
Great, thank you. Okay, so just to give you a little bit of background, the ASTHO Profile Survey is the most comprehensive survey, as some of you know, that ASTHO administers. We conduct the survey every 2 to 3 years to collect information about state health agency activities, structure, and resources. Prior surveys were conducted in 2007, 2010, and 2012, and this is a project that's jointly sponsored by CDC and the Robert Wood Johnson Foundation. The 2016 Profile Survey is going to be launched on April 1st, so it's not a joke if you get an April 1 email from us. A modified version of the survey is also going to be administered to the U.S. territories and freely associated states, and that's going to be in the field at the same time. So I wanted to go through some key dates as you're thinking about the Profile Survey coming up and kind of getting your team together. So today we're having our pre-launch webinar, and as I just mentioned, the survey itself, the link to the survey is going to be sent out on Friday, April 1st. The survey will remain in the field for 8 weeks, so we ask that you complete and hand in your surveys by Friday, May 27th. We're also going to have a webinar, so in addition to this webinar to kind of explain to you the logistics and process for the Profile Survey, we're going to have a webinar where we review content-related questions that you may have as you're filling out the survey, and that's going to be in the middle of April. In addition to these webinars, we're always happy to answer questions that you have about the survey along the way, so don't feel like you need to wait until the webinar to ask us. We will have our contact information up at the end of this presentation, and we'll also be sending out the presentation afterwards so that you have that information handy. Also, I want to note that we're going to be having individual calls with the U.S. territories and freely associated states in mid-April to review individual questions that they have, because it can be a little bit tricky for the territories and freely associated states, some of the questions, and so we are going to try and go through it. So in terms of how the survey is going to be administered, it's going to be a web-based survey administered online through the Qualtrics survey web platform. And senior deputies and state health officials will receive an email from ASTHO with a link to the survey on April 1st. So it will give you all the information that you need for how to access the survey and fill it out. The survey has a table of contents where we recommend who should fill out the different sections of the survey. So there's 8 parts to the survey. We ask for contact information. We ask about state health agency activities, structure, governance, and priorities, workforce, and we recommend the Human Resources Director fill that out, finance, recommended to be filled out by the CFO, planning and quality improvement, health information management, and then a few questions asking you to evaluate the profile so that we can make even further improvements for the next round. So as I mentioned, we have put recommended respondents in the table of contents, but we've also included the recommended respondent for each section at the top of that section. If that section is completed by someone other than the senior deputy, we ask that you provide us with the contact information for that individual should we need to follow up and ask any questions to clarify responses. So I think I've already mentioned most of the respondents here. So we recommend that you include the senior deputy, the HR director, the CFO, your performance improvement officer or equivalent, and your informatics director or equivalent in filling out the survey. So in terms of the logistics of the survey can be completed in multiple sittings and or by several people. However, I do want to stress that the survey cannot be completed by 2 people at the same time. So you'll want to coordinate to figure out who is working on the survey at a given time. The survey works best using Firefox or Google Chrome as your web browser. You can use Internet Explorer, but people have found that the other web browsers, it just has a cleaner look, so it gives the survey a cleaner look. So there's 2 ways that we recommend you going about filling out the survey. The first is that the senior deputy who receives the link to the profile survey forward that link to the different state health agency personnel who can then fill out the individual sections of the survey online. The second option, which may work better for some folks, is to print out hard copies of the survey and pass them around to have people fill them out at their convenience, and then to kind of gather all the responses and have someone fill in the data that you collect. So data for each page will automatically be saved by clicking the next button at the bottom of each page of the survey, so you don't need to hit save or anything like that. Just go to next and your responses will be saved. You can change your responses at any time before submitting them. However, do not press the back button on your browser, as this will exit you out of Qualtrics. So if you need to go back to another question on the survey, we recommend that you use the back button that's on the survey, or that you go to the table of contents and click on that specific question that you want to go back to. So to navigate the survey, as I mentioned, questions are divided into different sections and different subsections for easier navigation, so you don't have to scroll through a whole bunch of questions. If you want to, let's say, go to 2.6, you can click on 2.6 to 2.10. So what you'll do to get to a specific question is click on the table of contents. That's the icon that's pictured in the slide with 3 horizontal lines on the upper left-hand corner of the screen. And you can click on that and then click on any of the items to move throughout the survey. So I want to mention, as some of you may be familiar with, one of the features that we have in the ASTHO Profile Report are individual state profiles. And these are come from your responses to the survey, and we generate reports for each agency with individual key information. So these include the agency mission and the top 5 priorities, this agency structure and relationship with local health departments, organizational structure, health planning and accreditation, and workforce numbers. So each agency's state profile will be presented on the screen prior to your submission of the survey, and you'll have the opportunity to edit any responses that aren't accurate before you submit the survey. What we've also done is put in parentheses the question number corresponding to where the data has come from in the survey, so that if you look and say, oh, these workforce numbers don't really look right, you can go back to the specific question where you put in those responses and change it before submitting your survey. So to submit the survey, we're going to be sending out an email where senior deputies will receive a unique PIN number to enter at the end of the survey after you've reviewed your responses to the individual state profile and prior to submission. We ask that you review all of the responses prior to the submission to make sense. This will help ensure that we have less kind of follow-up to do with you and don't have to bother you to ask about questions or responses that may not seem to make sense. You can also print out a copy of your responses upon submission. There'll be a icon to print out your responses, so you can print those out if you want to have a copy for yourself. So I want to go through a couple of questions that we anticipated you might have at this point in hearing about the survey. And so first, you do not need any login information to fill out the survey. The reason why we have the individual PIN numbers that we send out is to make sure that the senior deputy has kind of signed off on all of the material that's included in the survey. However, you do not need any specific login information to access the survey itself. Another question that we are commonly asked about is, given the different structures of state health agencies, what part of their state health agency should they be responding for? So I wanted for a moment to turn it over to Katie Sellers, who is our Chief Science and Strategy Officer, to give us the answer to this question.
Good afternoon, everyone. I really wish this were an easier, simpler question to answer, and as simple as it looks, the answer is not terribly simple. But basically, the answer is we would really like for you to fill out this survey from the perspective of the state public health agency. Now, if every state had something they called a state public health agency, this would be a simple answer and we would be done. But that is not what it is in each state. In fact, I'm not sure that is what it is in any state. So what we're really looking for is the unit of your state government that includes the full scope of traditional public health services, such as chronic disease prevention, infectious disease prevention, maternal and child health, emergency preparedness, et cetera. In some states, this will also include environmental health. We're really trying to get at what is under the purview of the ASTHO member or the state health official. But in some states, what's under the purview of that member is also going to include programs such as Medicaid or senior services, which are not traditionally considered to be public health. And in fact, their budgets may be so large they may really dwarf the public health program. So we're asking that you don't include other departments that may be within an umbrella agency, such as Medicaid or senior services, if they are not public health. We're also asking that you do not include anything that is not under the purview of the ASTHO member. So if this is hard to understand given the context of your particular state, we would be happy to answer your questions offline. You know, you can say, my state has these departments, we're not sure which ones you want us to answer for. We're happy to answer that question on a case-by-case basis. I hope I'm making this clear, but I know it won't be clear in some circumstances. The other thing I wanted to say about that is that given the way that we're defining the state public health agency, we know that if you answer the questionnaire from this perspective, there may be some times when you're filling out the survey that you will indicate that you do not provide a certain service. Let's take substance abuse treatment as an example. You'll indicate that you do not provide this service, but actually the state government really does provide that service. It's just handled by a different agency. So I just want to say don't worry about that. If you indicate that you do not provide that service, we do not assume that it's not provided by the state at all. We're just interpreting this to mean that it is not provided by the state public health agency as we've defined it. So don't worry about sometimes answering no to some of these questions, even though state public health actually does provide these services. So I hope that's helpful. Again, we're more than happy to take questions from any one of you as to which portions of state government to include when you're answering these questions.
Thanks so much, Katie. So if you forget to print out a copy of your responses after submission, you can contact one of the ASTHO staff and we'll give you our contact information, and we'd be happy to get a copy of your responses for you. So it's pretty easy to print out on your own, but if you have any difficulty with that or forget, we're happy to do it for you. In terms of when the results of the survey will be published, we are going to be doing data cleaning and analysis and writing up the report, and we anticipate having the volume 4 of the ASTHO Profile of State Public Health published in the spring of 2017. So who do you contact with questions about the survey? So on the next slide, we've got our different contacts. So you can contact me, Rivka Levinson, Alana, our Senior Analyst for Survey Research, Tiho, the Senior Director of Research, or Katie, the Chief Science and Strategy Officer. I also wanted to make you aware of materials that we have available on our website. If you're interested in looking at any of the products from our 2012 profile survey, this includes the full profile report, a slide deck with each of the tables and figures that appear in the report, issue briefs and infographics, and your individual state profile report. Those materials can be found at astho.org/profile. So I want to pause at this point, and I think we're going to take everyone off of mute and find out if
the conference has been unmuted.
Excellent. So we're going to find out if there are any questions. Please feel free to either just say your question or to type it into the chat box, and we can read your question there as well.
have any.
We wanted to do the webinar at this point, even though we know you don't have the survey in your hands, so in some ways it's a little bit difficult to picture everything if you haven't done the survey before. We wanted to make sure to just kind of go through the logistics and the process for the survey so that you know that is coming down the pike, and also so that you have an idea of how it's structured and how we're asking you to fill it out. So we hope that in that way that this webinar is useful to give you this information. And it may be something that you want to refer back to. We'll be sending out the slides and also have this recording available. So these may be things that you want to refer back to once you get the survey to figure out how to do certain things. So we're happy to take questions now if you have any. Kate, is there anything else you want to add at this point?
I don't think so. We've been listening to your feedback over the years and really trying to take it into account as we're always trying to improve this process. And of course, one of the things we heard over the last year was that you wanted to know when the survey was coming, and you wanted to be told multiple times because particularly in the spring when you've got legislative session going on, this may not always be at the top of your radar screen. So that was part of the reason why we had the call today. We just really wanted to make sure that you knew it was coming, that you knew the details about it, and that you felt comfortable that you knew what to do and where to get more information when it does come to you in April.
Thank you. I also wanted to just mention really how useful and important the responses are that we get from you. We get questions all the time from members, from other organizations, from congressional staffers asking what states perform a given activity or have a certain kind of structure. And so it's this information that allows us to provide a national snapshot of what's going on. So we know that this is a heavy lift, but we really appreciate your participation in the survey and want you to know that your responses are being utilized to help make public policy decisions. So we really appreciate your participation and all of your effort, because we do know that it is an effort to have multiple staff members working on this.
We have one question.
This is Lisa Davis from South Carolina. I just have a quick...
Hi, Lisa.
Hi. So as states are completing the survey, if you are getting common questions from multiple states, can you then share that information back out with the rest of us so that we all have some clarity around, as I said, a particular question or any kind of questions that seem to be repetitive from different states? That would be helpful.
Yeah, that's a great point, Lisa, and that's something that we're definitely planning to do. We don't want to bombard you with emails every time there's a question, but we may do something like a weekly email where we send out questions that we've gotten that week about the profile. So that way we can let you know what questions we've been receiving that week. And as you said, oftentimes people have the same questions, and that way you can kind of see how we've responded to others with a similar question.
So I also see online there's a question about whether the webinar material will be available electronically. And so the answer is that yes, we will be sending out the slides to you by email, but also we will have the recording available on the website at www.astho.org/profile.
All right. Well, with that, we will keep it short and sweet. We know you all have a lot going on, so we appreciate your joining us. Before you head out, we'd like you to ask. We'd like to ask you to just fill out one question that we have, just so that we can assess how useful having this webinar and this information is. So if you could please just take a moment to answer the question that's going to come up on your screen. Then we would really appreciate that. So thank you. All right. Well, thank you and have a good afternoon.